Welcome everyone. Thank you for joining us today. We'll get started in just a few moments. In the meantime, please write in the chat box who you are and where you're joining us from. Please also make sure that you select your language. To select a language, please click on the bottom where you see the globe icon, and it will take you to the English or French channel. You can then choose to mute the original audio. Everyone needs to select a language to ensure that you are able to listen to all of our speakers. In addition, you may also select whether or not you'd like to read captions during this session. You'll see these captions pop up now. If you wish to hide the captions later, please select the icon with the two C's at the bottom of your screen and select Hide Subtitle from the menu that appears. These captions are generated using an automatic feature in Zoom, and therefore it might not be 100% accurate. On the Zoom platform, captions are only available in English at this time. We have also shared a few poll questions that we encourage you to respond to while we wait for others to join. If you'd like to read these questions in French, the French translation will be added to the chat box. As you note on the slide, the questions are in both English and French, and the answer choices are in English and French in the poll itself. Please take a moment now to introduce yourselves in the chat, select your language, select whether you would like to read captions during today's session, and answer the poll questions. Our first poll question is there data available in your country related to young people with disabilities and sexual and reproductive health? The second question is, does your country have a national policy on young people with disabilities and their access to SRH information and services? And 3, in your country, how well do the disability rights and the SRH communities work together to advocate? Again, if you're just joining us, please take this time to select your language, select whether you would like to read captions, and answer the poll questions on the slide and that are in the poll. Thank you all for introducing yourselves in the chat box. It's nice to see so many of you here. I want to thank you again for joining today, and I want to welcome everyone again to today's session. My name is Brittany Getch, and I'm a program officer on the Knowledge SUCCESS project at Johns Hopkins Center for Communication Programs. Knowledge SUCCESS is excited to be partnering with FP2030 on this series. This is our 14th conversation in the Connecting Conversations series. If you've missed previous conversations, you can watch the recordings on FP2030's YouTube channel or read blog post recaps that include recording links on the Knowledge SUCCESS site and get up to speed. This conversation will last for approximately an hour, and we'll have an open Q&A discussion with our 3 speakers and moderator. It's being simultaneously interpreted into French, as I mentioned, and it's being recorded in both English and French. The recording will be available in the coming days. If you haven't already done so, please select your language by clicking the globe icon at the bottom of the Zoom screen. It will take you to the English or French channel, and then you can select to mute the original audio. Everyone will need to select a language to be able to listen to all of our speakers. A reminder about closed captioning. You may also select whether or not you'd like to read captions during today's session. They should be appearing automatically, but if they are not, you can select these captions by clicking on the icon with the 2 C's at the bottom of the Zoom screen. And if you wish to hide the captions later, click on the same icon and select Hide Subtitle from the menu that appears. Participants are muted throughout the duration of this conversation, but if you have questions for our speakers, please type them in the chat box as you follow along. My Knowledge Success and FP2030 colleagues will be moderating the chat box and will get to as many questions as time allows. Just a little bit about this Connecting Conversations series in case you're joining us for the first time. Connecting Conversations is a series of discussions on adolescent and youth reproductive health hosted by FP2030 and Knowledge SUCCESS. We will be co-hosting these sessions every few weeks on a variety of topics, but this is not your traditional webinar series. We're using a more conversational style, encouraging open dialogue and allowing plenty of time for questions. The series has been divided into 5 themes, and we began with a look at the foundational understanding of adolescent development and health. We continued our conversations by exploring engaging critical influencers to improve young people's reproductive health. And our 3rd theme focused on adolescent responsive services. We're excited to kick off a new set of conversations on key youth populations with a discussion on young people with disabilities and ensuring inclusive access to SRH services. Before I introduce today's moderator, I want to begin by looking at the poll answers. So if we could bring those up. Thank you. The first question, is there data available in your country related to young people with disabilities and sexual and reproductive health? 17% of you selected yes, 29% of you selected no, and 54% of you selected not sure. So that's something that our speakers and our moderator will definitely talk about today. The second question, does your country have a national policy on young people with disabilities and their access to SRH information and services? 29% of you selected yes, 26% of you selected no, and 46% of you said not sure. And the third question, in your country, how well do the disability rights and the SRH communities work together to advocate? 23% of you said not at all, 69%, the majority of you selected somewhat, and then 9% of you selected extremely well. So thank you all so much for answering those poll questions. These are 3 areas and topics that our speakers will discuss today. Now, I'm pleased to introduce our moderator for today's conversation. As General Secretary of the Blind Youth Association Nepal, Ramchandra Gair has been working for the promotion of SRH since 2015 and is a leader in the inclusion of persons with disabilities in sexual and reproductive health rights. The Blind Youth Association of Nepal collaborates with various organizations to increase the understanding of SRHR of service providers, as well as develop the capacity of young persons with disabilities. Ramchandra also designs and develops accessible and inclusive programs and services for various civil society organizations as an independent consultant. Welcome, Ram. I'm going to hand it over to you.
Thank you, Brittany. It's been wonderful to moderate this session, and most importantly, this is also a connecting conversation. I would also say this is very much learning, sharing, platform as well. So once again, thank you so much to FP2030 and Knowledge SUCCESS project. which has been very much being inclusive in terms of covering diverse population, and that obviously include persons with disability. Today, I'm very privileged to have wonderful team of speakers who represents different sector with multiple responsibilities. I'm very much proud to have my three key speakers today in this connecting conversation. My first speaker for today is Cynthia R. Bauer, whose bio is quite impressive. Cynthia was a wildlife biologist who have significant career on her journey, who have visited Kenya, then realized how the situation for persons with disability, particularly for the children with disability, then she realized what would be the life if she was born in Kenya without one hand. So that inspired her to initiate Kupenda, a very wonderful organization working to promote the rights of children with disability. Cynthia, I'm very much pleased to welcome you in the program.
Thank you very much.
And we have another vibrant personality whom I and my organization, our entire persons with disabilities, are very much inspired. Miss Leila Sarafi, who is, it's wonderful to read her title. She is a global gender advisor, as well as the focal point for disabilities in the technical division at UNFPA headquarters. Ms. Sarafi has been serving since last more than 16 years with our expertise across various international organizations, including UNFPA, UNIFEM, and Executive Director's Office at the Secretary General's, as well as UNDESA. She has been very much focused in the area to promote the gender responsive programs and mostly to cover the women and girls who have faced multiple challenges as well as intersecting discriminations. So Ms. Sarafi, very welcome to the show. And I would also like to very much proudly welcome Ms. Zekia Mousa Ahmad. Ms. Zekia is a very active disability rights advocate who has finished her master's degree in psychology from the arts and humanity sector. She has been working as an independent consultant for various organizations, actively working to promote the rights of women with disabilities and also for other type of disability. And she has been also working as a consultant to the WISH project funded by Humanity and Inclusion. So with these very vibrant speakers on this show, I'd like to invite all of you to join this program. If you have any questions, please do not hesitate to write on chat box. We'll provide you enough space to interact, and we will try to respond any of the confusion as much as possible. So we'll try not to cross 35 to 40 minutes for this discussion, but most importantly, our audience, we would like to have you on the program to participate through the chat box. So without further delay, I would like to connect our connecting conversation. We have some questions, but most importantly, this is just the prepared question. So I'd like to request our speakers not to limit with the questions, but only with the timing. And I would like to just start from today's topic, which is ensuring the access of SRHR for young persons with disabilities. When we talk about adolescents and youth, there are a lot of variety, a lot of diversity within the young population from different intersects. And young persons with disabilities are also in line with that. So my first question to begin our conversation with Cynthia, when we talk about young persons with disability, what kind of people or what kind of scenario or who comes in your mind very top up? What do you immediately think of people when we think of young persons with disabilities? Please, over to you.
When you say the image, you mean of what I think of when I think of what people?
Who do you think? What kind of reflection comes to your mind when we think of people, young persons with disability? Yeah.
Yeah, I think of usually, especially when we're talking about sexual and reproductive health, of course, many of the girls that we support come to mind. We have children, young girls and adolescents that are often in a lot of our work. I think of some of our young girls that have cerebral palsy, some girls that are deaf, and because of some of their disabilities, they actually, not because of their disabilities, because of the society in which they live, they are not accessing the information that they need. So when I think about disability and more towards the sexual reproductive health here, I think of that. And the thing that comes most to mind, my head's a little clearer now, around disability is the stigmatization of people with disabilities around the world. And in our organization, we focus on transforming harmful beliefs connected to disability to those that improve the lives of children, because not just in low-income countries, but in the United States and around the world, there are many superstitious beliefs around different disabilities that maybe it's caused by someone's sin. People are seeking healing for these kinds of things, told it's their fault if they aren't healed from a disability. And even in some places, especially in the work we do in African countries, that people are told it's because of witchcraft. And when those stigmas exist, it presents challenges for every other aspect of development work.
Thank you. Thank you. I'll come back to you very soon. And Zakia, same question to you. Who comes to your mind when we talk about young persons with disabilities? Zakia, you are on mute. Can you unmute yourself? While Zakia unmuting herself, may I come back to Leela Safariji, because you have a very much global role.
Hello.
So same question. Yes, Zakia, yes.
Yeah.
Did you hear my question?
Yes.
Who comes to your mind when we talk about disability, please?
Yes, I've heard your question very clear. Yeah, okay. So when we talked about young people with disabilities, so without, this is actually comes to my mind is like people who within the age of different groups of children, adolescents, the youth who are living in different background or setting of urban, rural area, the rural, and actually who are they are affected differently in terms of the challenges, you know, because when you look at the specific people with disabilities, maybe they have been having the mental impairment, the intellectuals and visual impairment, the physical impairment. So those different challenges, this is actually make their diversity, you know, regardless of their gender, the origin, the colors, the cultures who they come from.
Thank you. Definitely, intersection and the various, these segmentations, various sectors has been very much, underlining the cause of disability as well as the different perspectives and different diversity that definitely comes. I'd like to come back to Leila Safari. Same question to you. What comes, or who do you think first when we talk about disability? Because you have a very much, global role as a focal person. What immediately comes to your mind? Who do you think first when we talk about these disability categories?
Yeah, thank you so much. And it's a pleasure and honor to be here. Thank you to the organizers for inviting me. To answer your question, as you very rightly said, because I work in a global organization and on this issue, certainly what comes to mind is diversity. In terms of the young people that I've met over the years, diversity in terms of, region, in terms of gender, in terms of age, and in terms of ability. I've met some wonderful young people who are really change agents and doing fantastic work, whether it's self-advocacy or working with policymakers. to change the way things are done in their country. So that's what comes to my mind, right, is the fantastic young people that I've met, young people, and including young people with disabilities is what I mean. So that's what comes to my mind first off.
Thank you, very well said. And my just follow-up question, nowadays, the disability inclusion or inclusive programs, many initiatives are now at least claiming that we are trying to be inclusive. So my just follow-up question to all my three speakers, what do we wish, or at least what do we want to see where the inclusive SRH programs fits the persons with a disability, mostly to the young persons with disability? What should be there, or what should have done to have a real inclusive initiatives where young persons with disability can be fitted or can enjoy those rights? Can we start from Zekia? Yeah, you are on mute. Maybe we can start up from Cynthia while Zekia is unmuting herself.
Come with the question again.
Oh yeah, sure. So many initiatives nowadays, even organization of persons with disabilities, many NGOs, civil society organizations, even governments, they are, most of the time, they are trying to be more inclusive. So when we talk about inclusive initiatives, inclusive designs, what kind of things you want to see or they should have done to include the persons with disability and their SRH rights? What do you think as an activist?
Yeah, you know, for the persons with disabilities to be really included, so that for them to easily get the SRH services, the inclusion should be in the accessible format. What do we mean? The accessible format is like, for instance, if you want if you have the place that a person with disabilities can come and have the services of FP or family planning that we say, you have to make sure that this thing is well accessible, the services are accessible, and even the place that a person who is going to access, persons who is going to that hospital, that particular hospital must be really accessible. RAM should be considered, and even if it is necessary, the referral procedure should be very clear. The paper even should be written in Braille. There should be sign language interpreter. All those things, you know, should be really there, so that it will make sure that inclusion are actually represented and accessibility is in place. The clear referral procedure should be in place. The coordination between the OPDs, I mean the Organization of Persons with Disabilities, coordination should be very important between the OPDs and the service providers. Awareness on misconception about the family planning, because, you know, according to our cultures, especially here in Africa, you will see that people having a lot of misconception about their family planning. So the awareness should be very clear there. And persons with disabilities, you know, they are the very best people who normally know how to do this awareness. If you involve them and if you include them to be part of your program to mobilize these people to understand, you know, the misconception about the family planning, everything will be okay.
Very well said. In fact, the awareness raising and also working with the organization of persons with disability, referral mechanism, accessibility, you point very rightly, the accessibility issue is very important. And when we talk about blind or deaf sign language interpreter, I'd like to ask the same question to Cynthia, because your profession was something else and something was really, you know, inspiring for you to work. Could you just a little bit connect your work and what Kupenda is doing to ensure these kind of accessibility or inclusion? You have previously also mentioned about the people with developmental disabilities, intellectual disabilities. So would you like to further jump here, Cynthia, please?
Yeah. Well, so I agree with everything Zekia said. Of course, accessible education is so important. And I wanted to add to that, that one of the challenges and one of the focuses of our work is to ensure that children with disabilities are actually being able to access that education. Because currently around the world, only 10% of people with disabilities are actually accessing education. So if you have amazing inclusive programs and you have great sexual reproductive health programs at the schools, it's not going to matter if those children are left at home, locked inside their houses, tied to trees. We've seen all of these situations. And so it's really important to actually ensure that in whatever work that you happen to be doing around the world, that you're including children with disabilities in terms of helping them to access education, understanding where schools are and where schools need to be and where schools need to have improved inclusion, because we found that some schools don't even have ramps. And all you need, and that many of those children do not need specialized education. They just need to be able to get into the building. There's other children, probably half of the children in our programs don't necessarily need specialized education. They just need to know that just because they look different doesn't mean they shouldn't be able to access school. And so we have in Kenya, where we first started, they do a lot of great work with sexual reproductive health and inclusion. I think once they get to school, and we're working on that to improve it even more, but the biggest challenge we found is getting the students to be found to go to school. Because currently in Kenya, I think they say 2 to 3% of the population has a disability, but we know that's not possible. When in the United States, 24% of the population has a disability. So worldwide, it's 15 to 20% at least, but no one's really done a comprehensive survey to know how many there are.
Mm-hmm.
And so one of our major focuses is to change belief systems, take away those stigma, tell people that children have a right to education with our community leaders, and they find these children, refer them to schools, and where there are no schools, our community leaders actually start schools or help to make existing schools more inclusive.
Yeah, great, Cynthia. You have rightly pointed out the data very much differing from one country to another, region to region. And in fact, in our poll question also from the participants, they have said that majority of the people have said that, not sure. Because most of the cases, I mean, when in my own experience working in disability and sexuality as well, one of the major lacking area that we found is the data gap. The data gap due to the discourse gap, because many people do not talk about these things. But now, at least the initiatives has been started. And that starting initiation is very much led by UNFPA. So Leila, could I ask the same question? Like, what do you wish to be inclusive SRHR intervention where people or the young persons with different disabilities be fitted?
Thank you so much. I want to just talk a little bit about some guidelines we developed 2 years ago with Women Enabled International. I think the important thing is before you have any services, you have to really have an enabling legislative and policy environment. And that's what these guidelines really talk about. You also need to ensure that your programs and the monitoring of those programs and services are really robust. You want to make sure that just because there are services, doesn't mean that they're necessarily sufficient. We have to make sure that they are of quality standard. And then, of course, as Zikia has said, accessible facilities are critical. The challenge that we have in terms of accessibility is, of course, not just the physical services. It's also the mindsets, the perceptions, the misconceptions that a lot of healthcare providers also carry with them with regards to young persons with disabilities. I think there's a lot of stigma associated with the idea of a young person with a disability accessing SRH services. Similarly, I think for young people in general, but that's an added layer of stigma when you say young persons with a disability. So I think that really, the truth is we do have a lot of knowledge out there now. We have a lot of guidelines, not just by UNFPA, but many other wonderful partners and actors. And I think really what's needed now is investment from the governments, the policymakers themselves. We have the CRPD, so we have the normative standards. We have what we call the AAAQ, which is standards and human rights for applying to goods and services. So AAAQ is an excellent sort of guideline, I think, for how we might think about services. So for example, the first A stands for availability, making sure that the services are available first and foremost. The second is acceptability, so making sure that the services are acceptable to the population, whether that's language barriers or cultural barriers. The third is accessibility, which of course is very much making sure that the populations can actually access these services, right? And you could see how for people with disabilities, this is certainly an important one. And then, as I mentioned, quality, that's the last letter of the AAAQ, quality. It's simply not enough to say we've got services. They have to be of a certain standard and quality. So I think that, you know, when we talk about what do we want to see, we want to see mainly the policy, the legal environment. We want to see the services being accessible and using the AAAQ. But most importantly, we have to change hearts and minds about how people perceive young people with disabilities, right? So I think that these are all things that are changing little by little, but we certainly have a long way to go.
Very true. Availability, acceptability, affordability, and obviously the quality. The services that we are accessing, because now first thing people always think, you know, availability and the accessibility, but then the quality issue, very important. And my follow-up question with you, Leila Safari, then I will come to Zekia. Please try to unmute yourself, because after Leila, I'd like to come to you, then Cynthia. So many programs still try to cover the persons with the disabilities, but most of the structures, mechanisms, systems, policy, plannings, budget, these things are rarely designed keeping people with disability in mind. So how do you think the possibility of the adjustment, if the programs are not possible to redesign, how do you see the adjustment of the reasonable accommodation or these inclusive features, or in a long run, designing from the inclusive perspectives? Because many things are already designed. When we see the physical infrastructures like buildings, those even lack the ramps and other accessible features. So adjusting in existing program is one thing, and redesigning the new innovations from the inclusive perspective. What do you see these two components? How do you see? Yeah, Leila Safari. One is I'm asking, you know, adjusting in the ongoing programs, the adjusting this accessibility issue in an ongoing program, and when we design the new things, you know, ensuring all these AAAQ, where we are in this journey.
Yeah, I think you made a very good point. You know, one thing that the Special Rapporteur on Health, sorry, the Special Rapporteur on Persons with Disabilities in her report, I think 3 years ago, said that it's really important to remember that many of the services we're talking about don't need to be standalone specific services for persons with disabilities vis-a-vis health services. It's really, majority of the time, a matter of adjusting the services and making them accessible. For sustainability, that's just what works best. And I would encourage everyone to look at her report, Catalina de Vandas, her report from, I believe it was 3 years ago, on accessibility of health services, which I think was an excellent report and cited some great examples. Now, in terms of adjusting, again, I think that this really, both in terms of adjusting and new programs, we know that it's essential that persons with disabilities are engaged and involved in informing how those services need to be adjusted and how those new programs or services need to be built. So that is number one priority. Without their input, without this input, it's really not recommended, obviously, the principle of participation and the CRPD, but it's also critical that we understand how best to do it, right? And the services that are used by persons with disabilities, young people with disabilities, they know best. And I think that in terms of again, adjusting or establishing new ongoing programs, it's critical to understand that investment is going to be necessary. And I think that this is the challenge we've been seeing with a lot of the normative frameworks, all of the commitments, all of the programs, binding and non-binding commitments that are out there in the world. You know, the challenge continues to be a lack of investment. I do think there is some lack of know-how, but more and more, as I said, we know what to do. We know what the guidelines are. It's a matter of really ensuring that, number one, we have participation of persons with disabilities to input into that process. And number two is really about investment.
Very, very important, participation and investment. So Zakia, same question to you. Like, you know, how do you see, you know, adjusting the inclusive or reasonable accommodation and such features and redesigning with inclusive feature that are more universally designed? How do you see the programs for young persons with disabilities, mostly on SRHR? What is your observation?
Yeah, I get it. Actually, I just agree with my sister, Leila, I think. You know, just for me here, I will just see it's like the improvement. Because right now we are able to know about the inclusion, we have been trained about how to include persons with disabilities. Now we have to improve all those things that we have been given before. You know, we have, if the coordination between the OPDs or the organization of persons with disabilities are not well with the services providers, especially in the area of reproductive health, we have to make sure that we really improve in terms of coordination. Then we have also to make sure that we really improve in the area of the referral, the clear referral system procedure. If yes, it will be there, the referral, but if there is no clear accessible system, it will not help. So we have to improve that one. We have to improve the clear referral system procedure so that it will make persons with disabilities will be easily to access the SRH services. Then we have also to improve, yes, we have to involve persons with disabilities in terms of awareness of, again, I mentioned this thing again, because, you know, it is very important if persons with disabilities are well involved in all this program, because they believe worldwide that nothing should be done for us without us, you know. But actually there is a difference between nothing should be done for us without us than nothing should be speak about us. You have to speak about us, but not do this thing for us. So in terms of this, you have to involve persons with disabilities in actually coordinating this awareness, especially in the area of SRH services. Then readjust it. Yes, this is something that is going to be new, and you want to make a design. You want to create something that actually will involve persons with disabilities to be part of it. Here, you have to mainstream disability first in your program, and you have to make sure that they are really participate. Yes, by participating, you have to make sure the barriers that hindering their participation is reduced. Then who to identify that barrier? For you, you don't have any idea of how to identify that barrier. So persons with disabilities are the one who will teach you there's a barrier here. So when they are teaching you that there's a barrier here, this is where you are now well known about persons with disabilities, on their participation, how to reduce the barrier. Then another thing, you have to start collecting the data, you know, either by using a Washington group of questionnaire. Then if you don't know about the Washington group of questionnaire, even persons with disabilities themselves, they don't know that thing, then we have to start engaging training. If you are the one who know about the Washington group of questionnaire, you are the one who now train persons with disabilities how to use that Washington group of questionnaire. So you have to start collecting the data, because you will not make project. You don't know the numbers. You don't know how many persons with disabilities living here. Then lastly, you have to build their capacity. You know, capacity building is very important, so that you will make sure their participation is actively there in the project.
Very, very well said. As Leila Sarafi mentioned, you know, investment because somehow we know, what to do. Documents are there, guidelines are there, standards are there, policies are there. But the investment, participation, removal of the barriers, ensuring accessibility that will promote the sexuality and the disability. Very well said. I'd like to come back to Cynthia, but before that, our colleagues from FP2030 are also monitoring the chat box and clustering some questions. We'd highly welcome our participant to ask your question on chat box. Very soon, we'll be having your response of those questions. Our colleague Kate is clustering the chat box. After Cynthia, I'd like to hear from the floor any questions that you would like to ask, or comments, or anything that relates to today's conversation or today's topic. So Cynthia, same question. What is the possibility of adjusting the ongoing program, adjusting the inclusive factors or the accessibility features, or rethinking from new line, that is universal design and inclusive perspectives? What do you want to say?
Yeah, so I just want to say Zikia and Layla, like, we're very thorough, so I'm not going to repeat what they said, but I agree with what they said. But I do think on top of all the great things that were spoken before, is that teachers, people in the school systems need to actually have a better understanding of disability in general. And this is multiple disabilities. I know disabilities are so unique, and each person with a disability is unique, even if they have the same disability. However, there is a common thread around the world of desexualization of people with disabilities. And so sometimes there's a thought that, say you're a child or an adolescent with a developmental disability, or you're someone with a wheelchair, you don't actually need to know about sexual and reproductive health because you're not viewed as a sexual being, even though children with disabilities, people with disabilities are at least 4 times as likely to experience sexual abuse. So it's this strange dichotomy where they're seen as they're non-sexual beings, yet are also raped more often than people without disabilities. And I think that people in the mainstream sector need to have an understanding when they're looking at their populations that they're working with, and you don't see people with disabilities. I want people to start asking why. Where are they? Because a lot of people will say, well, we have accessible programs, we're not going to turn people away. Of course, we're doing all this stuff. But if you're doing all of this and you don't have any people with disabilities that are your beneficiaries, there's something going on, because with at least 20% in the low-income countries of people having disabilities, there's going to be people with disabilities. And like Zikia said, people need to start learning how to identify who they are, where they are, and understand in general, just a little bit of information goes really far in our communities. And we actually go to the source of some of the stigmatization, which are the faith leaders, the government leaders, the educators, to even just give them ideas and the humanization of people with disabilities, because so often people with disabilities, even those that are being taught in school systems and special education, are often seen as children unable to be educated, in addition to people not actually having a future where sexual and reproductive health is important. So I think humanization is a very important aspect. And it sounds silly to say it, but unfortunately it's very important.
Yeah, humanization, very, very true. Because stigma, another major challenge. And I like the point very much, as you said, like, teaching school system, preparing the faith leaders, government representatives, because the source of discouragement, source of discrimination are mostly from the public representatives, or these kind of, structural system where the mechanisms, systems, structural components are creating a lot of barriers, which are generating this stigma, and collectively working on this training, education, very important. So we have a couple of questions from chat box where my colleague Kate is beautifully monitoring. Kate, can I pass you the floor to share some of the questions that are asked from our participant? Over to you, Kate, please.
Thank you, Ram. Yeah, again, encouraging people to drop some questions into the chat box. Or perhaps people are just so transfixed by what you're saying that they're not generating any questions. I'm sure they have some, but there are a couple questions that have popped up. One is, and you've mentioned this a little bit about the stigma that people with disabilities often face. And I think there's a question about how do you begin to overcome some of these stigmas. In my own experiences, sometimes communities accept that people with disabilities live in their communities, but they don't really actively do anything to mitigate some of the cultural stigmas and challenges. So I think what I'd love to hear from you all is maybe some specific examples. I think perhaps the group would like to hear some very specific examples of how you've been able to overcome some of those stigmas and challenges that people with disabilities face, especially adolescents. So that's the first. So
I can, if it's okay, I'd like to jump in there, because stigma is our big, that's our thing really, stigma reduction. And we actually have a one-day workshop where we first did it with pastors and church leaders, and we now have a one-day workshop with traditional healers. We have one for government leaders, we have one for parents. Church leaders and traditional healers, especially on the coast of Kenya, are the most influential when it comes to the belief system. So we believe in going to the source of the problem, because we believe that just as much as these faith leaders and religious leaders are the problem, they're also the solution. And we found that in a DFID study, we did an 18-month data collection on our workshop participants, and we found that 65% of our participants reported that they had gone into the community, found people with disabilities, referred them to schools, referred them to medical intervention, and also advocated, whether it would be speaking in small government and community-based groups about what they had learned in our workshops about disability, and talked about the rights that people have. And we have found that one workshop of about 25 people can actually benefit 384 children with disabilities. And so we have a very organic process, and we're doing more in-depth training to help with things like, once our community leaders go out there, they're like, okay, we're getting into these really difficult situations. There's a child in a wheelchair with cerebral palsy who was raped. What do I do? So we're doing an abuse prevention training. We're doing more training on disability types and causes, so they have a better understanding. The more we can educate people on the true causes of disabilities, the less they're likely to believe in superstitious causes, especially that when we do our workshops, we are always ensuring that people with disabilities are helping to lead the workshop, that they hear stories from people that have been affected by disability. And we found that that's one of the most influential, and they're always called to action at the end. Say, now that you know this, what are you going to do? And I've been very surprised myself in terms of how effective it's been for us.
Thank you very much. We have a couple of questions received from our participants who have registered. One question was related to the young students who are at post-secondary or in a college level. So what are the provision of inclusion or exclusion? What makes them to include when it comes to preventing the gender-based violence or sexual violence? Or what is the situation of inclusion or exclusion? How can we ensure that the college students or university graduates are fully inclusive and also free from sexual violence and gender-based violence? My question to Leila or Zakia from the floor, as well as this question. Would anyone like to respond?
Sure, I can respond very briefly and then maybe turn over to Zakia. I think one of the things that we know regarding, of course, women and girls with disabilities is the high rates of gender-based violence that they face. UNFPA published a study about 3 years ago, that really underlined how young persons with disabilities are challenged in terms of access to SRH services, but also the high rates of GBV, gender-based violence, they face, which is often underreported and not talked about enough. I think the question from the participant in the audience about how do we make sure that they're, for example, protected and prevented from facing either on-campus violence or violence in the context of their social circles, or I think it's important in the same way we talked about services being inclusive and making sure that the services are accessible, right? So not necessarily creating specific standalone services for young people with disabilities. The same goes for any prevention programs that are ongoing for preventing violence against young women and adolescent girls. They must be inclusive of the disability perspective. So it's important to, of course, have those prevention programs in place, but it's also important to ensure that there is a lens of thinking about the diverse women and girls who might be facing violence, and therefore adjusting the programs, the prevention programs and services, so that they are inclusive and welcoming for women and girls with disabilities. That, for example, in COVID, during COVID, what we saw a lot of is, unfortunately, globally, in every country, in fact, we saw the increase of gender-based violence, domestic violence, and sexual violence. Under the COVID-19 pandemic, we saw a huge increase. Now, what we also tried to do is adjust our programs, right? So that when we're responding to gender-based violence, we made sure that they were still possible under COVID, with lockdowns and with critical health services being shifted to the response to COVID, many social services being cut off. It was very, very challenging. But some of our programs were able to adjust. And the important thing is to understand that even those programs that pivoted have to be made more accessible, right? Whether it's, hotlines that women and girls can call when they need help for violence, making sure that they're accessible, making sure that if in fact there are, let's say, mobile services that come to women and girls for addressing violence, prevention and response, that in fact, if a deaf woman is there to receive services, she's able to communicate with the service providers, etc. So I think that, again, the main message is, don't forget about the women and girls with disabilities, and whatever you're doing in let's say, for example, in this case, to respond to the question, prevention of violence on campus or for college students, please remember to include the girls and young women with disabilities in any prevention work you're doing.
Ram, I just want to pose a question.
Yeah, please. Yes, can you read couple of questions in a cluster so that our speakers can respond in lump sum? Yeah.
Sure. We have only about 5 minutes. I think this is probably going to be our last question. But I'm curious to know perhaps some of the strategies that you all have used to engage people with disabilities. I think sometimes we talk about we need to engage people with disabilities, but people with disabilities oftentimes, like you said, sometimes Cynthia said, they're hidden away, they're locked in rooms, they're tied to trees. So what are some strategies that you all have used to find and engage people with disabilities? And then kind of a second question to that. Thank you, Cynthia. I'm glad that mental health is considered as well. And that was sort of another question that was posed. But Layla, you spoke a lot about women and girls. And Ram, I'd be curious to hear about some of the challenges that you have seen that young boys face. And I'm speaking about this based on some work that the Global Early Adolescence Study has done, which has found that adolescent boys between the ages of 10 and 14 are highly, highly vulnerable to sexual abuse and other types of abuse. So I think it's important that we're also considering adolescent boys with disabilities as well as women and girls. But anyway, some specific ideas about how you engage people with disabilities, how we find them and how we bring them to the table so that their perspectives are represented. Maybe Zekia can start with that.
Okay. Okay. I just want to go a bit for the previous question about the GBV. For us here, I just want to bring a live example and our umbrella, the Women with Disabilities Network. For us, we have to advocate. We used to advocate, and we are still advocating that the rights of women and girls with disabilities are really respected. We have to make sure that the rights of persons with disabilities, especially women, because you see globally, 10 times they are really facing the GBV. So we have to make sure in our organization, the rights of women and girls are really respected. And it will not just come like this, by regulation, by doing the policy, and this is the role of all of us, the stakeholders, the government, the NGOs, the OPDs, all of those actors will actually be involved to come with the laws, the policies that protect the rights of persons with disabilities. Coming to the question of how we can engage persons with disabilities, if I'm not mistaken. Is the question like this? Hello?
How can we engage persons with disability,
Yes.
and how can we also ally with the organization with and without disabilities? First, how can we engage persons with disabilities, and also how can we ally, how can we collaborate between the organization of persons with disability and without disabilities?
Okay.
Pretty much at the end of the program. So can you summarize? I'll be highly appreciating.
Okay, how can we engage by, persons with disabilities are really there in the OPDs. We can involve them in our program. We can involve them in any program that we really want to do. When we have that program that actually there in our organization, persons with disabilities, we will just find them in the OPDs and they are there. And some of them, the capacity is not built, the capacity need to be built. So that this is the kind of engagement, that's how you can engage persons with disabilities. Then how can we ally with those who do not have a disabilities? Yes, of course, this is by networking, doing a networking, sharing our experience, sharing our ideas. The organization who are not focusing on the disabilities, when they come, they will focus also on the disabilities. They will mainstream about the disabilities. And for this, and with this, actually, we are really together and we are the same in the inclusion of persons with disabilities. Just in summary, I will say like that.
Thank you, Zakia. And same question, how can we involve persons with disability, and how can we ally between OPDs or other civil society organizations? Cynthia, your closing remarks.
Okay, I thank you so much for having me participate today. And I think, again, sometimes it's there's some things that are just really simple that many people don't even think about in the first place, which is, again, to start looking around in your programs to see, like, where are the people with disabilities? Are they being included? And then ask yourself, why not? And I think that overall, we just need to be sure that we're talking to the influencers, we're explaining to them the importance of inclusion and what that really means. And when we talk about disability, I know we're very general, that includes all disability types, whether it's someone who's just missing a limb like me, or it's someone who is nonverbal, someone with severe autism, someone with schizophrenia. Any disability you can think of is something that needs to be included. And so it becomes difficult to generalize. But we do need to ensure that we even start the conversation, which I'm grateful to hear that this conversation is even happening, which I don't think was happening even 5 years ago. So I'm excited about that, and I hope that it continues. And if people are interested in communicating with me more, please feel free to reach out. I think that the key is that things don't have to be always expensive to start the process. If we can just make people aware to begin with, I understand that we need to be sure lots of services are accessible and so on, but we have children with disabilities who have very minor disabilities that only make them look different, don't affect their ability to learn, but they're still excluded from school because they're not seen as being worthy of that. So sometimes it's very simple. So thank you very much for having me share. And I'm excited. Thank you so much for Zakia and Layla too. I've learned so much from both.
Thank you so much.
So we
Thank
are
you,
at
Cynthia.
time.
So wonderfully said. Yeah.
We are at time, Ron. So
yeah. Okay.
No, go ahead. Because I did boys.
Yeah, we just wanted to have a final remarks from Leila Sarafi. How the organization, funders, or civil society organization and OPDs can ally. Just final, if you may want to add.
Yeah, I just
Leila.
thank you so much again, and me too. I've learned so much from Zakia and Cynthia and Ram yourself. I want to just thank you for having this conversation. Totally agree with Cynthia. I think long overdue, happy to see it happening more and more than even compared to just a few years ago. I think in terms of allying, it's critical that, when we talk about social justice, we see the different movements coming together. And as Zakia said, it's networking, it's making sure that, when the women-led feminist organizations are thinking, they're also thinking about persons with disabilities and vice versa. So I think that it's critical just to be inclusive and make it happen. But again, when we talk about, I think Zakia had said, when we talk about participation and inclusiveness, it's important that we take the time to think about, making sure that those engagements are accessible, whether it's, you know, meetings or conferences, just taking a step back and asking the question and normalizing these questions. Is my meeting accessible? You know, how can we ensure everyone can get to the meeting place? How can we ensure that, you know, everyone can understand? In the same way that in the UN, we're used to doing language interpretation, we're really trying to, you know, normalize and integrate sign language interpretation in everything we do, for example. So I think that, you know, this is critical, just making sure that the movements start coming together. And I just wanted to say that I shared some resources over the chat, including a guidance that we just developed with many partners, including UNESCO and others, on technical guidance for programmatic guidance for out-of-school youth, on CSE, on comprehensive sexuality education, and also the guidelines I referred at the beginning of the program on accessible services, and then finally a whole new package that we're actually launching today, which we're very excited about, that is a result of consultations with many persons with disabilities and OPDs around the world, looking at how the COVID pandemic has impacted their access to services. So I've shared that over the chat as well. And thank you so much again. And as Cynthia said, as well, if you have any questions, please do feel free to reach out to me.
Thank you so very much to Lela, Cynthia, and Zekia. You made this connecting conversation wonderful. Apology for a little bit exceeding the time to our participant, but thank you so much for today's conversation. Yes, indeed, initiation, you know, normalizing and acceptance, this will solve the solutions that are potentially coming in the future. Well, with this, I'd like to thank for everyone joining this. Kate, over to you for the closure.
Thank you, Ram.
Thank you,
and thank you to everybody. This was an incredibly interesting conversation. I'm actually just going to pass the baton to Brittany. But I also just wanted to put in a plug. Don't forget about boys with disabilities as well. They're very vulnerable and we need to be thinking about them as well. So Brittany, over to you.
Thanks. Thanks, Ram, Zekia, Cynthia, and Layla for such a great discussion. And thank you all for really thoughtful questions. We'll be posting and sending out a recording of today's webinar, and we'll hope you'll join us for our next conversation on July 8th at 7 a.m. Eastern Daylight Time, where we will explore very young adolescents and leveraging this key life stage to improve SRH. If you haven't already done so, you can register for this upcoming conversation and all upcoming conversations at the website in the chat. We also wanted to share an upcoming Knowledge Success event as well. Please join us next week for our pitch watch parties. The pitch, hosted by Knowledge Success, is a competition placing stakeholders in Sub-Saharan Africa and Asia at the center of designing and implementing knowledge management innovations. More than 80 organizations submitted ideas. 10 semifinalists were selected to pitch their idea to a panel of judges, and now we're ready to announce 4 winners. So please join us next week. Our Asia Watch Party is scheduled for June 30th, and our Africa Watch Party is scheduled for July 1st. We encourage you also to follow FP2030 and Knowledge Success at the handles and websites you see on the screen here to stay up to date on resources, activities, and upcoming events. And again, thank you speakers and our moderator today for joining us, and thank you all for such a great conversation. We'll see you soon on July. Oh, I'm sorry. Go ahead, Kate.
One more thing, sorry, Brittany. I just wanted to also let people know that Humanity and Inclusion, Pathfinder, and FP2030 have developed a curriculum for training healthcare providers on adolescent reproductive health. And FP2030 provided some funds to develop a module for that curriculum to train providers on how to work with adolescents with disabilities. And we will be launching that material July 21st. So we will we'll put that out on social media and hope you can attend that as well, because that will be a tool and a resource that many of you might be able to apply in your programs.
Great. So lots of great, exciting new resources and events coming up. So please be sure to follow FP2030 and Knowledge SUCCESS to keep up to date on all of those resources, activities, and events. And we'll see you next time on July 8th. Thank you.